Hi, I'm Dr. Nichelle Haynes.
And I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, and irregular period, even infertility.
Today we're going to talk about postpartum anxiety.
So postpartum anxiety is often missed because a lot of women think, I'm not depressed, so I don't have anything going on with me postpartum. This is just really hard and I feel really angry and I'm really rageful. But there's something besides postpartum depression called postpartum anxiety that can be just as common as postpartum depression and is just as important to get treatment for.
So what are some symptoms of postpartum anxiety? We have rage.
So this can be kind of irritability in that most days you're feeling really irritable, you're snapping more than normal, it feels like it's hard to control your anger, and you know that that's not how you usually are.
Often that comes with a lot of guilt and worry. What else? We might have difficulty controlling the worry or feeling like it's like ever present. I can worry about this, I can worry about that. There might be one particular thing that you're worried about, but it might just be, I could be worried about anything.
Yeah, oftentimes I describe it as like just excessive worrying. Like you understand that, okay, this probably isn't something that's likely to happen, but I cannot stop worrying about it and worry about everything under the sun.
Muscle tension?
Muscle tension and not being able to relax. So a lot of times people just feel really tense, they get tension headaches, they feel like they can't relax their shoulders, their neck, and they can't just like sit down and relax and kind of take some time to breathe.
Common places that I will see the muscle tension: jaw, neck, headaches because of the neck tension, shoulders, be like common places that you like really feel really tense. Which of course can be complicated if you're breastfeeding, but like a lot of times you're like kind of looking down and that can create some tension too. So, you know, it's important to mention everything that's going on so that you can talk it through. Maybe it's muscle tension from anxiety, maybe it's muscle tension from something else, but that's one of the symptoms of anxiety in the bigger picture that might point towards anxiety versus something else.
Another thing that can be really common with postpartum anxiety is not being able to sleep when the baby's sleeping.
So this could be, your mind is kind of ruminating over the things that you're worried about. The to-do list kind of go through your mind, that you kind of go down these rabbit holes of the what ifs, and your brain, you have a difficulty shutting the brain off to get some rest when you know you really need it and you're tired too.
Or your body's just so wound up and on edge that you can't relax enough to fall asleep. And when you're postpartum, obviously you're not getting great sleep anyways because baby is waking up throughout the night, you can't really take naps during the day, but you should be exhausted enough to the point where after a week or so of adjusting to this new crazy schedule, you're able to fall asleep easily, you're able to sleep when the baby's sleeping, and you don't have problems kind of taking naps during the day or getting some good sleep at night.
What else? Intrusive thoughts?
Intrusive thoughts can be really big with postpartum anxiety. And so what we mean by that is that these thoughts just pop into your head uncontrollably. And oftentimes with postpartum anxiety, they're really disturbing thoughts or images of bad things happening to your baby or bad things happening to other people that you love.
A lot of people are worried about bringing these like bad thoughts up to their clinicians because they think it will be interpreted as I want to do these things and that people are actually in danger. And people who are trained clinicians in perinatal mental health will know how to ask the questions and what things are reassuring and what things would be a little bit more on the concerning side. So when you have that discussion, you make it clear about like kind of you don't like these thoughts and they're uncomfortable. Those kinds of things are reassuring for us. So
a lot of times people can feel like I'm going crazy because I'm having these really scary thoughts, like what if I act on these thoughts? What if I lose control? Those are all reassuring thoughts that you're having though, because that means that you're not going crazy. Your mind is just extra good at like thinking of all the ways that you need to protect your baby. And so sometimes our mind can think of, just crazy things that might happen. And the important piece is to realize that these aren't things I actually want to do or I actually want to happen. These are things that I'm really worried about and I feel really scared that they might be there.
It's a sort of a manifestation of love, that you're so worried about your baby that your brain is looking for anything that could happen to the baby, and it's kind of too good and kind of will internalize, maybe I could accidentally do something to the baby. And when you conceptualize it as I love my baby so much, I don't want anything to happen to them, it can be a little freeing to say, these are separate from me. These are thoughts that are happening to me. Often, anxiety can be such a present part of your mind and your muscles and things like that, that it can contribute to fatigue as well. So you have the fatigue of the postpartum period when you're not sleeping, and this is sort of above and beyond that, that your brain is working on overdrive, that it's contributing to tension and poor sleep, that of course, you can feel even extra fatigued from the anxiety as well.
And speaking of your brain working on overdrive, another symptom can be trouble focusing and kind of staying on task, because your brain's thinking about all these different worries, and so it's really hard to kind of just focus on the present and the now and what you're doing in the moment.
Mm-hmm. How many times have you had someone come to you and say, I'm newly postpartum, I think I have ADHD?
Oh my gosh.
And it's been anxiety.
All the time.
All the time. All the time. And I think, it's important to have those discussions, because maybe it is ADHD, but so many times people are having the difficulty focusing. I just can't get anything done, and it ends up being that they have anxiety. Yeah.
So if you're worried about any of these symptoms and you've noticed that you have a number of these symptoms, it's really important to talk with your doctor or clinician about what you're experiencing. Like I said earlier, it's just as important to treat postpartum anxiety or anxiety in pregnancy too, as it is to treat depression in pregnancy and postpartum.
Mm-hmm. Right. There's so many ways to improve anxiety, and you don't have to live being anxious.
Yeah, you don't have to suffer. We know that anxiety is such a hard thing to go through. And I think the important piece to point out is that by taking care of yourself and your anxiety, you're really doing what's best for your baby, because postpartum anxiety and anxiety in pregnancy can have really big risks on the baby's growth and development. And so really you're doing the best thing for your baby.
Thank you for being here today. If you like this video, please like, comment, and subscribe to our channel. We'll see you soon.
Bye.